Our first MCQ of this video, the primary drug of choice in cardiac shock will be, so options are there: normal saline, ephedrine, naloxone, epinephrine, amphetamine. So these options are given, and the MCQ asks us about the primary drug of choice in cardiac shock. So actually epinephrine, that is D option, this is actually the primary drug of choice in cardiac shock. So D is our right answer here. Now the second MCQ, friends, the maximum daily dose of captopril is actually an angiotensin converting enzyme inhibitor, or simply ACE inhibitor. This is actually used in controlling blood pressure and other cardiac conditions. So captopril maximum daily dose is, options are given, and the correct option here is 450 milligram. This is actually the maximum daily dose limit of captopril, that is 450 milligram. That is recommended daily maximum dose, beyond which some adverse effects may appear. So that's why this maximum daily dose limit is set for captopril. So E is the correct option here, friends. Now the third MCQ, a drug of choice during chemotherapy of leishmaniasis. So for leishmaniasis we have to identify the drug of choice. Praziquantel, metronidazole, pyrimethamine, pentamidine, sodium stibogluconate. So actually the drug of choice for chemotherapy of leishmaniasis is sodium stibogluconate, that is E option. Now the drug of choice during chemotherapy of schistosomiasis. So again options are there: praziquantel, metronidazole, pyrimethamine, pentamidine, sodium stibogluconate. So actually the drug of choice for chemotherapy of schistosomiasis is praziquantel. So A is the correct option here. Now the fifth MCQ, drug of choice during chemotherapy of giardiasis is, so options are there: praziquantel, metronidazole, tinidazole, nitazoxanide, sodium stibogluconate. So for the chemotherapy of giardiasis, the drug of choice is metronidazole. And now the sixth MCQ, drug or drugs of choice during chemotherapy of toxoplasmosis is, so this is actually a condition of infestation. So options are there: pyrimethamine, sulfadiazine, leucovorin, and D option is all of the above given in combination, while the E option is praziquantel. So actually these three drugs, pyrimethamine, sulfadiazine and leucovorin, they are all given in combination during the chemotherapy of toxoplasmosis. So actually D is the correct option here. Now the seventh MCQ, the duration of chemotherapy for giardiasis is 5 days, 1 week, 14 days, 1 month or 3 months. So the duration of chemotherapy for GRDSs, that is actually the minimum recommended duration of treatment for GRDSs is actually 5 days. So 5 days is the duration of chemotherapy for GRDSs. Now coming to the 8th MCQ of this video, one of the following medicinal agents is used in the chemotherapy of tapeworms infections, which is mebendazole, thiabendazole, ivermectin, pyrantel pamoate, albendazole. Actually, the medicinal agent that is used in the chemotherapy of tapeworms infections is albendazole. Now the 9th MCQ, biltricide. It is brand for biltricide is actually a brand name, that is a particular company manufacture this generic with a certain brand name, biltricide, and the generic of biltricide is, this is actually in the question of the MCQ, that biltricide is brand for, that is the generic of biltricide is praziquantel, albendazole, pyrimethamine, pentamidine, sodium stibogluconate. Actually praziquantel is the generic for biltricide, so A is actually the correct option here. Now coming on to the last MCQ of this video, friends, all of the following pharmaceutical agents are antiviral except one. So famciclovir, foscarnet, trifluridine, glycofulvin, didenosine. In this MCQ we are asked to identify the agent that is not antiviral. So actually famciclovir, foscarnet, trifluridine and didenosine, these are all antiviral agents except this D option here, glycofulvin. This is not antiviral, it is actually antifungal agent. So D is the correct option here. So friends, I think this is enough for this video.